Hi, I'm Dr. Aliza Pressman here at the Aspen Ideas Festival. I'm a developmental psychologist, co-founding director of the Mount Sinai Parenting Center, where I'm assistant clinical professor, and author of the book, The 5 Principles of Parenting, and host of the podcast, Raising Good Humans. In my book, The 5 Principles of Parenting, I chose the principles that are rooted in science that are actually something we can control ourselves as parents and caregivers, and that have been shown to really move the needle on resilience. Those principles are relationship, reflection, regulation, rules, and repair. And when we can lean into those principles more often than not, so none of us needs to do this perfectly. In fact, repair wouldn't be possible if we got everything right. Then our kids have a really great shot at resilience. And we too, as the adults in their lives, are doing what we can to care for ourselves and others. I think parents really want to raise resilient kids. Resilient kids, to me, is not just the capacity to bounce back in the face of trauma, stress, adversity. It's also a lot of parents translating that to, I want my kid to be happy, and misinterpreting what I think they really mean is, I want my kid to be able to be happy again. We're never gonna be happy all of the time. No human could be happy all the time, nor would it be healthy or safe. But the idea that we want to see our kids know that things can turn around, that even though it was a hard day, a hard moment, a hard year, that all is not lost. That is resilience. So when we think about the challenges that we're faced with today, one of the biggest questions I hear is, what do I do about social media? It's really scary. The messaging out there is, it's destroying our children's minds, but it's also something our kids can't live without. I lean back into the 5 principles. If you have a close connected relationship, you can set rules so that your kids have the limits and boundaries around these devices that can be harmful, so that the harm is much more mitigated. And for some kids, you're gonna be reflective. That's another principle, reflection. And you're gonna say, this is not right for my child's brain. Their particular brain is not suited to this. They have a predisposition to anxiety, depression, eating disorders, so many different things that might put them at higher risk in using these apps. And then, of course, self-regulation. Regulation, another principle, is also really important when you're dealing with social media. Not just for our kids, but for ourselves, because if we're freaking out and letting ourselves spin out over something that these challenges that are coming our way, we're not able to be there to co-regulate with our kids. And finally, repair, for when it just doesn't go well and you find yourself in a battle, you can come back to repair and reconnection, and you start again. So I would say with all of these challenges, though I don't diminish how hard they are, we can lean right back into the same answers that we have with any challenges that we're going through. The challenge with social media isn't just the scrolling and scrolling and scrolling, although having all of that input constantly is harmful or can be harmful. But there's another piece, which is, what are we posting on social media about our kids, about ourselves? How are we modeling use of devices? What are our rules saying, and what are our behaviors saying? So we need to check in with ourselves about that. And in doing so, we're modeling for our kids as they emerge into a time when they might have access, when they might be going on social media, that they've kind of grown up seeing that we're thoughtful about what we post. What we put out in the world stays out in the world. And so we need to be mindful of the digital footprint, and we need to ask permission. Don't post something about your child if they haven't said, hey, that's totally fine with me. And remember that young children don't really understand the implications, so it's a bigger decision. Having adolescents and being a mother, particularly moms who are going through changes in their own lives, so adolescence sometimes really maps to moms in perimenopause, and that's highly linked with changes in mental health. And so paying attention to our oxygen mask, and it sounds so cliche, put your oxygen mask on first, but we know that the #1 environmental influence on our children's mental health is having one adult caregiver who is available to them because they are mentally well and who can be there for them, see them, love them for exactly who they are. So we need to make sure that our mental health is cared for before we can do anything for our kids. There are so many resources out there for parents, making sure that you find voices that you feel safe with, that you feel like, okay, I'm not gonna listen to all of the information. We're so inundated. Pick people that you feel like you don't feel worse hearing from them after they've spoken. You know that they give reliable and valid information, and they speak to the values that you hold dear. And we try to have as many resources for parents as possible, particularly in those early years, 0 to 5 at the Mount Sinai Parenting Center. We have free resources that are available not only to parents and caregivers, but to healthcare providers. We have resident training programs. We're in over 260 hospitals across the country. It's free and it's scalable, and it integrates the information that parents are longing for into the well-child visit in that very short window of time that physicians have, because we know that physicians don't have extra time to talk about the things that parents want to know. And so we can weave it into existing moments. And that's the same thing we try to do for parents. We don't want to add work for anyone, but there is a way to make sure that in those moments you're changing a diaper, you can also have a really close connection with a smile and a sing-song voice. Then you're not doing homework to connect with your baby. You have to change the diaper. Why not change the diaper in a way that actually bolsters brain development and connection? We have a program called Keystones of Development. And so we looked at sort of what are the things that we can teach physicians and parents that are in everybody's control. And it goes back to the same thing I said about the 5 principles of parenting. It's so much easier to focus on things we can do something about that are free and easily accessible. And so when you think about the attachment relationship, when you think about bolstering self-regulation, when you think about figuring out how parents can teach discipline, positive discipline, helping the parents along in this journey where they are feeling frustrated because they might not know what's developmentally appropriate and what feels just like an act of aggression against a young parent, because young kids have a lot going on. So we tried to figure out a way to, again, give this information rooted in science that is just part of your everyday experience. It's free, it's easy to do, and it changes the trajectory of our children's health and our relationship with our care providers. So it's really important to think about, like, how are the different ways that we can give parents this support so that they feel more supported and more able to do this incredible job that is raising our kids. My grandmother said to me, she collected frogs, not real frogs, stuffed frogs. It sounds really eccentric. But she said, I love frogs because they always jump forward. And in moving through the world, especially as you're becoming a mother, because I was pregnant with my first child, just remember, there are gonna be so many moments you wish you could just take back and keep moving forward. And I think that's so true now that I know the science of repair. And I think about what my grandmother said. It's such a beautiful thing because we need to reflect and think about how our past sort of influences today, but then we can move forward with the real belief that you can come back from anything as long as you have the intention and the will to keep that love sort of connected and supported.